I'm Dr. Abdo, and we'll be performing a basic cranial nerve examination today. The first cranial nerve is the olfactory nerve. We're not going to be testing that today since it's just a sense of smell. I want you to, we're going to test first the pupillary light reflex for cranial nerve 2. What you want to have you do is have your patient stare off kind of into the distance. If you have them look at your finger and have it come in, it can impair your pupillary response. So if you can stare off into the distance for me, I'm going to shine a light into one eye. And as you can see, both pupils constrict. As I go to the other eye, both pupils constrict. And as I swing the flashlight from back and forth, the pupils stay the same size. If you see the pupils dilate or get bigger on one side or another, that indicates that there's a problem with cranial nerve 2 on that side. We're going to check cranial nerve 2 right now via visual fields. It's very important to give your patient very good directions. So you'll have them stare directly at your nose and tell you how many fingers you're holding up total. And look directly here for me. How many fingers am I holding up total?
4. 3.
Okay. And if there's no abnormality there or no visual complaint or reason to suspect something else is going on, that is adequate for testing visual fields by confrontation. The next cranial nerves that we're going to check are the cranial nerves that move the eyes, 3, 4, and 6. So what I want you to do is just to follow my finger. So you're going to have him move slowly across, and you're going to look for any abnormalities and eye movements, any jerky movements or anything like that. As you look to the far left, you can see about 2 to 3 beats of nystagmus on this gaze. Now that is normal. That is normal end gaze nystagmus, and you will see that quite often in some patients. The key is that it goes away after just a few beats. Now I'm going to have you look and up and down, and then up and down. All right. And now we're going to test for convergence. So have your patient kind of just follow your eyes in. The eyes should come in, kind of cross, and the pupils should sort of constrict there for you. Next, we're going to do test cranial nerve 5, which is sensation to the face. There are 3 branches that innervate the face: the upper, middle, and lower part of the face that are innervated by different branches of cranial nerve 5. So what you kind of do is you just come up here, and does that feel the same as on both sides right there?
Yes.
And then you're going to check on, you'll do the same thing at V2 and V3. The next cranial nerve that we're going to test is the facial nerve. There are 2 components to the facial nerve that can indicate where a lesion is in the brain. So you want to test both the upper face and the lower face. So can you give me a big smile, please? As you see, the nasolabial folds are nice and symmetric. And you can go and close your eyes for me really quickly. And I'm going to try and open your eyes up. Don't let me do it. Good. And then can you wrinkle your forehead for me up just like that? All right, puff out your face like a fish. And just hold it there. All right. Don't really see any asymmetry or any changes in cranial nerve 7. Now we're going to test cranial nerve 8 for hearing. And you just kind of do a nice rub next to each ear. Does that sound about the same to you?
Yes.
Okay. And that's really all you need to do to test cranial nerve 8 very briefly like that in a basic screening examination. The next thing we're going to check are cranial nerves 9 and 10 for gag and phonation. So can I have you open up your mouth real wide for me? And you're going to look in the back and have your patient say, ah.
Ah.
And the palate should elevate symmetrically on both sides right there. The next thing we're going to test is cranial nerve 11 and the sternocleidomastoid muscle. So when you're turning the head to the left, the right sternocleidomastoid is performing the action. When you turn it to the right, it's the left sternocleidomastoid. This is a very good technique in patients who you suspect are malingering or have some sort of conversion disorder, because they tend to turn weakly to the same side. I'm going to have you turn to your right for me, and I'm going to have you turn to the left for me. All right, very good. The next thing we're going to test is cranial nerve 12, the hypoglossal nerve. All right, go ahead and stick out your tongue for me. All right. Tongue's in the midline, looks okay. We're gonna go ahead and close your mouth for me. I want you to take your tongue and stick it into the side of your mouth for me, just like this. I'm going to attempt to press in. The tongue is the strongest muscle in the body, and you really shouldn't be able to press very hard, and it's the same on both sides. There is no set order to performing this examination. As you kind of go through, you can develop your own methods and practice. It's just important that you standardize and do it the same way each time so you don't miss or forget certain aspects of the exam. This is a basic cranial nerve exam done in real time. Okay, I want you to kind of just stare off into space for me, and I'm going to shine a light in your eye. All right, very good. I want you to take a look directly at my nose. Tell me how many fingers I'm holding up total.
3, 4.
All right, very good. Open up, say ah for me.
Ah.
Okay, very good. Does this feel about the same on both sides right there?
Yes.
Okay. I want you to follow my finger here. All right, and follow it in for me. All right, big smile. Show me all your teeth. Close your eyes for me. Don't let me open them. Shuffle up your forehead for me. All right, very good. Does that sound about the same on both sides?
Yes.
All right, stick out your tongue. All right, put it in the side of your mouth here. Don't let me press it in. Don't let me press it in. Do it over here. Very good. I want you to turn your head this way and turn your head the other way. All right. Very good. And that is the basic cranial nerve exam. We're going to perform the motor and reflex exams. The thing you're looking for in motor and reflex exam is symmetry between both sides. So you'll want to test each side sequentially and each muscle sequentially on each side. So test the biceps on the left, test the biceps on the right. So the first thing that I'm going to have you do is hold your arms up in the air for me, upside down, and close your eyes for me. Right here we're checking for something known as the pronator drift. You can go ahead and relax. This is a very sensitive sign for a pyramidal tract or motor weakness. The patient will kind of slightly, once they close their eyes, one of the arms will slightly pronate and come down. And it's a very sensitive and specific sign. In fact, many times if you just see a straight drift without pronation, you're looking at a different type of disorder entirely, or a different type of weakness. Okay, so what I want you to do is, can you just shrug up your shoulders for me? So we're testing the deltoid muscle right here, and you can test each one kind of at the same time. The next thing we're going to do is test the biceps. So what I want you to do is just hold your arms up. So what you want to do is isolate the muscle, so go and relax for me just a little bit. So bring the muscle out to 90 degrees and support the joint. And then you're going to pull really hard, actually, and don't let me pull you back. Okay? In a young, healthy male, you have to give a lot of resistance to be able to detect subtle weakness, especially if you're smaller or not as strong as the patient you're examining. So again, isolate to 90 degrees and give a really hard pull. Okay, very good. That's the biceps that we're checking right there. Next thing I'm going to do is I'm going to press him inward and check the triceps reflex. And here we go, the triceps muscle. And same thing right here. And as you see, I'm testing each muscle sequentially on each side in order to elicit any subtle signs of weakness. What I want you to do is just kind of relax your hands for me. I'm going to try and press up. Don't let me do it. We're testing wrist flexion right here. Okay. And same thing right here. Okay, raise your hand up just a tad bit. Now we're going to test wrist extension. Good. And same thing right here. Okay. And I want you to do this grip for me. We're going to test the distal strength and grip. As you see, I'm putting my index finger, my middle finger, onto his index and middle fingers. And just hold, don't let me pull. Very good. And the same thing on this side, don't let me pull. Again, you can with doing these can help you detect very subtle signs of weakness in a patient on your motor exam. Spread your fingers out, and again, same finger to same finger. Same finger to same finger. And don't let me press in. Good. And go just like this for me, and spread your thumb up, just like that. Don't let me press down. checking the abductor pollicis brevis for median nerve findings. Okay. That's the basic upper extremity motor exam. The next thing that we're going to check is reflexes in the upper extremity. Grading of the reflex is by the least amount of stimulus used to elicit the reflex. So that means the lightest touch that I touch that gets me the reflex is what I grade it as. So if I hit somebody really hard in a reflex and it jumps up, that's not the grade of the reflex. The grade is the least stimulus that elicits that reflex. Okay, so again, we're gonna test symmetrically and on both sides. So just relax for me. To test the bicep reflex, I usually like to support the patient's arm and mine. I palpate the biceps tendon and then hit. And then we're going to do that on the other side as well too. Support. And your patient needs to be relaxed. So you can tell them just, hey, relax just a little bit. Move the arm back and forth, and that also helps to relax the muscle as well. Now we're going to check brachioradialis reflex. Again, have them at 90 degrees, relax, and there. And then we're going to switch it to the other side. Next, we're going to check the triceps reflex. And relax for me. So the arm needs to be kind of at 90 degrees, relaxed. Palpate the triceps tendon, and then hit. And same thing right over here. Okay? The reflexes should be symmetric on each side. If they're not, then it indicates some sort of lower motor neuron pathology. Next, we're going to test the motor and reflexes of the lower extremities. The first thing that we're going to do is check the hip flexors. Again, we're checking for symmetry. So what I want you to do is brace yourself on this bed here, and I want you to lift this leg up as high as you can. Don't let me press you down. Don't let me press you down. Very good. Go and relax. And same thing right here. Okay. The next thing we'll check are the hip extensor muscles. So, and basically the way you can generate the most force from this muscle is by having the patient stand up. So I want you to cross your hands across your chest and just stand up for me. Okay. All right, very good. The other thing you can do is you can have them step on a stool or a bench and press themselves up with a single foot. Would be another way to elicit subtle weakness. The next thing that I want you to do is kick out your leg for me. So we're going to check the leg extensors. And slightly bend your knee just a little bit, and I'm going to give you some force, and I want you to resist me. So I'm going to press the knee, and I'm going to press hard on it. Okay, go ahead and relax. And then we're going to do the exact same muscle on the other leg. And slightly bend, and resist. Good. Okay. The next thing I'm going to do is I want you to slightly bend the leg, and I want you to resist me from pulling it up. This is going to check the flexors here, and go ahead and brace yourself. And don't let me straighten it. Good. And same thing right here, and don't let me straighten. Okay, very good. The next thing we're going to do is we're going to check the foot for dorsiflexion, plantar flexion, eversion, and inversion. So what I want you to do is raise your toes up on this foot and don't let me press down. Good. And we're going to do the same thing on that one. Don't let me press down. Good. Next thing is I want you to bend forward and don't let me press up. Good. And same thing right here. Don't let me press up. Again, I'm isolating the muscle on each foot. And the next thing we're going to check is for eversion and inversion. So if you see somebody that has a foot drop, it indicates you're looking for weakness of inversion. If they have weakness of eversion, that's indicating that the problem is actually higher up than just the peroneal nerve. So I want you to invert that foot for me, and don't let me press out. That. And invert your foot right here. Don't let me press out. Okay. And I want you to have it that way, and don't let me press in. And then the same thing right here. Don't let me press in. Okay. And that's the basic. That's basic motor for the lower extremity. Now we're going to check the lower extremity reflexes. So have your patient relax and palpate your patellar tendon, and then tap. It's a little bit easier sometimes if they're off the bed, but you can also take the reflex if their feet is on the ground. Okay, and again, you're testing for symmetry, and it's the least amount of force that you give to elicit the reflex, which you grade it at. Now we're going to check the patellar reflex, and you're going to see me and what you need to do is slightly dorsiflex the ankle. This can be accomplished in a number of different ways. One way is to have the patient just put their feet onto the ground. You can have them put their feet on the ground, and that gives you that slight dorsiflexion, and then you strike with the reflex hammer on the Achilles tendon, and you can elicit the reflex that way. Or you can have them kind of lift their foot up and you slightly manually dorsiflex it, and the same thing. A lot of patients can get a little bit tense while you're checking reflexes at times. So one way to elicit reflexes in a difficult patient is using something called an eponym called the Gendrasic maneuver. So you'll have your patient kind of grip their hands together like this. And what I want you to do is when I tell you to pull, and as they're pulling, tap the reflex, and that helps to bring out patients whose tension and anxiety is kind of impairing the examination. Now we're going to perform the motor and reflex examination on a patient that's lying down. So what I'm going to have you do is lift this hip up off the bed. Lift your left hip off the bed for me. Hold it up, and don't let me press down. Don't let me press down. And again, you see I'm giving a lot of force. I'm going to test the other side sequentially. Very good. All right, very good. Lift up your leg slightly. Okay, go and relax for me. I'm going to try and lift your leg off the bed. Don't let me do it. Good. And same thing right here. Good. I'm going to have you bend your knee just slightly for me here. Don't let me bend it any further. Good. And then the same thing over here. Good. And bend it slightly. I'm going to try to straighten your leg. Don't let me straighten it. And same thing right here. Good. Press your foot down for me. Don't let me press up. Press this foot down. Don't let me press up. Lift your foot towards your head. And don't let me press down. Same thing right here. Good. Now pull your foot inward for me. And don't let me pull out. Inward, and don't let me push out. Push your foot that way. Don't let me pull in. And the same thing right here. Next, we're going to check reflexes in the lower extremities. To elicit these in the lower extremity, you're going to slightly lift the leg and support your patient's leg. Make sure that they're relaxed. And then you just hit the patellar reflex. And you'll do the same thing on the other side. Again, it takes very little force to elicit that reflex. Now to check the Achilles reflex, you can give a slight amount of dorsiflexion to the foot, and then hit your hand right there. And that elicits essentially the same thing. The last thing that we're going to check is the extensor plantar reflex, or the Babinski sign. So first thing that you want to do is warn your patient that this is going to be a little uncomfortable. And then you're going to gently stroke the outside lateral portion of the foot and go slowly. And as you can see, his toes come down. And then we're going to do the same thing over here. Okay. In performing that reflex, you have to distinguish between somebody who is uncomfortable and is pulling away from you, or somebody who actually has the actual response. One of the things that you need to look for is that the extensor hallucis longus, which is the muscle that pulls the big toe up, is the one that's moving the foot. If the extensor hallucis is moving, that indicates that it's the pathologic reflex. If it's the back of the leg, the soleus, that's moving, that indicates more that it's the patient withdrawing from your foot. And we're going to perform the full motor exam in a patient that's lying down or in a bed. First thing I'm going to have you do is hold your arms out just like this and close your eyes for me. All right, very good. No pronator drift. Go ahead and relax for me. I want you to hold your arms up just like this, and I'm going to pull you this way. Don't let me do it. And the same thing right over here. Don't let me do it. Okay. And I'm going to press you inward now. Don't let me do it. Okay. Same thing right here. Good. Take your arms, hold them up just like this. Don't let me press down. Don't let me press down. All right, very good. Take your hands, go just like this. Don't let me pull out, and don't let me pull out. Spread your hands just like that. Don't let me press in, don't let me press in, and don't let me press in, don't let me press in. And keep your thumb spread. Very good. Put your hands over like this, flip your thumb up just like that. Don't let me press down, don't let me press down, don't let me press down. Good. Take your hands, just go like this. Don't let me pull, don't let me pull. And the same thing right here. Very good. Now I'm going to check reflexes, biceps, brachioradialis, triceps, Okay. Now we're going to move to the lower extremities. I want you to lift this leg up in the air for me. Straighten it out for me. And don't let me press down. Don't let me press down. This leg right here. Very good. Very good. Go and relax for me. Don't let me lift the leg up. Don't let me lift it. Good. Same thing right here. Brace. Don't let me lift. Good. Take your leg. Just slightly bend it. Don't let me bend it anymore. Good. Same thing. Don't let me bend it. Don't let me bend it. Very good. So, sort of straighten it and just bend it just a little bit for me. Bend your leg just a tad bit. Don't let me straighten it. Don't let me straighten it. And don't let me straighten it. Don't let me straighten it. Good. Push your foot down all the way. Don't let me press up. Push your foot down. Don't let me press up. Towards your head. Don't let me press down. Towards your head. Don't let me press down. Inward. Don't let me press out. And inward. Don't let me press out. Outward. Don't let me press in. And outward. Don't let me press in. Very good. We're going to check reflexes here really quickly. Slightly lift the knee. Okay, and here we go, and there we go. And then I'm going to scratch the outside of his foot here. Okay. And that is a basic motor and reflex exam in a patient that's lying down. All right, now we're going to perform a basic motor and reflex exam on a patient who is ambulatory. Can I have you hold your arms up in the air for me, just like that? Close your eyes. All right, go ahead and relax. I want you to hold your arms up just like this. I'm going to pull you this way. Don't let me do it. Same thing right here. Very good. I'm going to try to press you in and don't let me. Same thing with this arm right here. Very good. Take your shoulders, shrug them up for me. Don't let me press down. Don't let me press down. All right, very good. Take your hands, kind of hold them out just like that. Take your thumb, hold it straight up for me. Don't let me press you down. Don't let me press you down. Grip your fingers. Don't let me pull. Don't let me pull. Take your wrist and just go up for me. Don't let me press it down, and don't let me press it down. And take your wrist and bend it, and don't let me press up. Don't let me press up. All right. The next thing I'm going to have is I'm going to have you lift this off the bed. Don't let me press down. Don't let me press down, and don't let me press down. Don't let me press down. Kick your leg out straight for me. Don't let me bend it. Don't let me bend it, and don't let me bend it. Don't let me bend it. Bend it slightly here. Don't let me straighten it. And don't let me straighten it. Don't let me straighten it. Good. Press on the brakes for me. And press on and push your foot down all the way. Don't let me press up. Push your foot down. Don't let me press up. Lift that foot towards your head. Don't let me press up. Lift the foot towards your head. All right. Push it. Push your foot inward. Don't let me press out. Inward. Don't let me press out. Outward. Don't let me press in. Outward. Don't let me press in. Very good. Let's check your reflexes here really quickly. I'm going to scratch the outside of your foot. Just relax for me. Last thing I want you to do is stand up, hold your arms across your legs, and stand up for me. All right, very good. And that is a basic motor exam. I do want to briefly discuss reflex hammers with you. The type of hammer I use is this Tromner hammer. It's a versus kind of the one that most people use. The real difference is that the head of this hammer is much heavier than this one, so it takes a lot less force on this hammer to elicit a reflex. If you're constantly having to hit hard, and you are going to have to vary your strength, and this is a much more difficult one to elicit reliable reflexes with. These costs, the ones with plastic handles cost somewhere around $15, and it will make eliciting reflexes for you much easier and much more accurate than using one of these. The other thing is that the tips of the heads of these are much harder than this. So you're actually going to elicit some pain if you're checking reflexes with the appropriate force on this one. So now we're going to be assessing the patient's gait overall. The gait is a large coordination of basically all neurologic function. It requires motor, coordination, sensory, to all be integrated and to be working for it to work. So the gait can be a very good neurologic screening examination. So we're going to have our patient walk normally here, and there are going to be certain things that we'll pay attention to. So if you want to go ahead and take a few steps that way. So we're going to look at his arm swing. His arm swing is symmetric on each side. A subtle decrease in arm swing can be a manifestation of early neurologic disease. The other thing that we're going to pay attention to, if you can continue walking for us, is the base of his gait. His base of gait is very narrow. In patients with a neuropathy, they may have a bit of a wider based gait and have a little bit of difficulty in terms of balance. The other things we're going to do now are going to be a little smaller assessments of his balance and strength. So we're going to go ahead. Can I have you walk on your heels for me? Okay, and can I have you walk on your toes? Okay, and the last thing I always tell my patients that we're doing is we're doing the drunk test. So I want you to just walk one foot in front of the other for me. Okay, all right, very good, and go and come on back. And patients that do this have very good balance and gait. One of the things you can do to test really subtle weakness of one hip or another is have your patient kind of bend down on one knee and press up with just that leg. And you can have them do both legs, and this will pick up very subtle signs of weakness as well too. And that is the basic assessment of gait.